My name is Karen Jarvis, and in January of 2009, I made a New Year's resolution. I had been in pain for 3 or 4 years. It was in my lower back. It went all the way down to my feet, down the sides of my legs, and sometimes my feet would go numb. And it was really interfering with my life. I wasn't able to do all the things I wanted to do. Just the more I stood, the more I walked, the more it hurt, and I was living on ibuprofen. It was just not a good situation. So that was my New Year's resolution. I was going to do whatever it took to get free from pain that year. Up until that time, I had actually been to my primary care doctor, and he recommended that I do some x-rays, which we did. It showed some compressing of the vertebrae, but he said, I think if you just do stretch exercises and take ibuprofen, that should take care of the problem. Well, it continued to get worse. So by the time Christmas of '08 got here, I had to do something. So this was my New Year's resolution. In January, they scheduled an MRI for me, and that did show that I had a bulging disc. The orthopedic surgeon that I went to see said, well, we could do surgery, however, I can't guarantee that would help. What I would recommend you try first would be a lumbar injection in your back, and he said sometimes that will actually break the pain cycle. He also suggested to keep doing the stretch exercises. I had the shot, and it really did seem to help. The first 3 months or so, I was fine. Then the pain started coming back. So I scheduled another shot in May. After having that shot, I just felt like that wasn't doing any good because it just didn't seem to take care of the pain at all this time. So by June, I'm still trying to find something to solve this problem, and in more pain than ever. I had heard a lot about spinal decompression, so I opened the phone book and honestly just flipped through there till I saw an ad, and I thought, okay, I'm calling this chiropractor and I'm going to try spinal decompression. I went in and showed him my MRI, and he said, I believe that spinal decompression could help you, so we started out on that, and I did 15, 16 treatments or so, and truthfully just felt like I was getting worse. And by the way, I was still doing stretch exercises along with that. So by this time, I just don't know what to do. Well, my cousin and her husband had been going to see Dr. Roadhouse, so she suggested that I try him. She said, I think, he might be able to help you. What have you got to lose? Okay, so now it's August, and I go see Dr. Roadhouse, and I tell him what all I've been through. Well, I show him my MRI, and I will have to say he was very thorough going over the MRI with me, much more so than anyone else had been. First, he told me that there were 2 bulging discs and there was some spinal stenosis. And he said, I believe that with the brain-based therapy that we do, and if I'm going to do a neurological exam and see if your cerebellum is out of proportion or not functioning properly. He said if we do the spinal decompression along with the oxygen and the other therapy, he said, I believe that we really can help you. So it sounded like it was worth a try. Even though I had done spinal decompression and was hesitant about it at first, I thought, well, okay, we'll do this other and see what happens. So I started on my therapy in September, going 3 times a week, and took a little while to notice an improvement, but also I was not doing any stretch exercises. I quit doing jazzercise. I was really not even walking or standing very much. So we continued to do 3 times a week up until the end of the year, and now I'm in my 5th month, and I'm going twice a month. And I'm also back in jazzercise. The pain is almost completely gone. I have a little every now and then, but it's just very, very minor. I hardly even notice it. I really feel like that we've gotten to the bottom of it now, and we've really found the solution. It took a long time and a lot of different procedures, but Dr. Roadhouse found the answer, and I appreciate it so much for everything that he and his staff have done for me to get my life back, and I'm very, very pleased with all the progress we've made.